Our first step is to cleanse the area with HibaCleanse. Next, I'm going to outline the areas where I'm going to place, again, the neuromodulator. In this case, I'm going to use Dysport with the 3 cc dilution. So I'm going to make 2 injections on either side, and I'll place about 10 units on each side. I'll put 2 injections of about 8 units on either side. I like using 2-hand traction technique always. The injections are somewhat superficial, but into the DAO, depressor anguli oris, and into the mentalis muscle. So next, we're going to outline the area where we're going to implant the polyalactic acid. I like using a deep depot injection, and I usually enter from inferiorly and then use a fanning technique. We're just going to again try to eradicate a little bit of that mentalis crease to soften it. The patient will continue about a 5-minute massage 3 to 4 times a day for 5 days, and that completes the treatment program with the polyalactic acid. Now, to complete the treatment of the nasolabial and mediolabial folds, I always like to add a little bit of support. Here I'm using Juvederm Ultra Plus into the modiolus area. That will give, again, some uplifting of the mediolabial line. Next, we're going to begin addressing the nasolabial lines. And we like to put just a small amount of material. I'm aspirating prior to injecting into that area. We don't want to create rounded facies on the lower third of the face. We just want to give a little bit of structural support. Our treatment began using a neuromodulator to, again, relax the mentalis and also give some slight elevation of the depressor anguli oris around the mouth. Then we use a combination approach of using polyalactic acid and a large molecular weight hyaluronic acid derivative. The polyalactic acid will give structural support to the lower face fat pads and also some long-term smoothing and rounding of the mandibular area and lower third of the face. Then finally, to soften the nasolabial and mediolabial folds, as well as to add a little bit of structural support to the modiolus, we used a large molecular weight hyaluronic acid derivative, Juvederm Ultra Plus, to complete, again, our lower face rejuvenation program.